Questions for Dr. Miller and Dr. Huff? Yes.
Yeah, one is real quick and the other is a bit more involved. The first one is, what is SERM in your
What's a SERM?
SERM,
med? And then the second one is, I've heard different things about carbonated drinks,
yeah.
having acceleration of osteoporosis. Is there any truth to that? Or not?
So I'm actually going to attack your, oh, go ahead.
No, go ahead.
Sorry, attack is the wrong word. First, I want to talk actually about your carbonated drinks. Actually, you're right. You're on the right course. One of the big things we see is in, hate to say it in Atlanta, but Coca-Cola or Pepsi. Many of those drinks actually leach calcium out of your bones. So that's one of the whole ideas of why you develop kidney stones from those type of drinks. So you're actually on the right track with that. So again, lots of water. That's very, very important. I just blinked on the selection, yeah. And I'm going to defer to her.
So the SERMs are selective estrogen receptor modulators. They act as estrogen agonists, meaning they'll be positive, as they'll act like estrogen in certain areas, or they'll act like anti-estrogen in certain areas. So a very popular one that most people know would be tamoxifen. It's a therapy that's usually used for the prevention of breast cancer in high-risk patients, or in patients who have been diagnosed with breast cancer and have estrogen receptor positive, because the tamoxifen acts negatively in the breast to help prevent recurrence.
Okay. I'm going to go over here. You over here because you're a new question.
More of the sodas.
Up top?
In my neighborhood, we have what we call a lazy river, and it has jets that shoot out. And I wanted to know what the effects of the jets shooting on different parts of your body. Does it aid or is it worse? Because I've been thinking that it was aiding because it didn't hurt. It made my joints feel better, but I want to know.
No, it does not hurt. It actually, if it makes you want to go down that lazy river more, that's just fine. It's not going to hurt anything. You may get a bruise if they hit it too hard, but otherwise it doesn't hurt anything. Oh,
The question was like water jets being put on your body. Were they effective or not? Okay. Yeah. Can you stand up and speak loudly?
I have two questions. The first question is about sciatica and women wearing heels. My second question is about drinking soy milk versus homogenized milk for estrogen. For women who cannot take hormone replacements due to predisposition of breast cancer.
Okay, the question had to do with what's the association between wearing high heels and what about sciatica, and also about use of soy products for bones.
okay. For estrogen.
Estrogen replacement?
So when we talk about sciatica, what we're actually describing in many cases is compression of the nerves as they come out from your spine, okay? You can have compression further down, like in your buttock area, but basically sciatica is where the building blocks of your spine, they can collapse down and you get bone spurs. And as the nerves exit out, they're being pinched coming out, okay? So that's what we call radicular pain or sciatica. So you may not have back pain along with it, but you do have that pain that runs down the back of your leg. Now, the things that can help that, again, are anti-inflammatories like Advil, Aleve, medications like that, core strengthening so you have better posture to take the pressure off of those areas. We've shown that physical therapy is absolutely excellent in that, and yoga is actually equal to physical therapy when you talk about back pain, radicular type pain, or that sciatica. Now, when it talks about heels, the thing about heels, not so much of an issue with sciatica, but actually it will tighten up your Achilles tendon and you can develop some Achilles tendonitis. If you wear heels, your body is used to heels. So when you go flat, many times people will complain of leg pain and back pain from wearing flats because that's what your body's gotten used to. So for other reasons, for foot problems, podiatry issues, and you stop wearing your heels, make sure you stretch out your Achilles tendon, your heel cord, your hamstrings, because everything's going to start hurting if you don't.
In terms of soy therapy, when you look at some of the studies that look whether or not it has effectiveness versus traditional hormone therapy or some of the other secondary treatments for specifically vasomotor symptoms, so we're talking about the hot flushes and the night sweats, there really isn't a difference between the soy products and just placebo. And we kind of look at the traditional hormone therapy or some of these other secondary ones as being superior to soy. Is it going to hurt? Absolutely not. But is it actually helping in terms of symptom treatment? Probably not better than placebo.
Yes. You.
Okay, in relation,
Stand up, please.
in relation to sleep, everybody talks about sleep. Now, I've heard you need about 6 to 8 hours, and I get that, but do I have to, let's say, get it all at once? I sleep very well in church. Very well in church, and I sleep very well in the theater, at the movies, you know, and when I'm sitting in meetings and sessions, you know. So I get sleep, I just don't get it all at night, at one time.
So I think you pointed out something that you're actually falling asleep in areas for wakefulness. So you're probably not getting enough sleep. So even if you look at your cumulative sleep, that it may be 6 to 8 hours because you're getting a half an hour here or an hour here. And forgive me, I don't know too much about kind of the stages of sleep, but you're not getting probably enough restful sleep, which is probably happening at longer periods of time at night. So sleep on.
Right here. Yes. You.
And I'll also, if any of my internal medicine colleagues want to comment on it, but when we look at the long-term effect of atherosclerosis, HDL, kind of my understanding, HDL is the good cholesterol, actually, not that it reverses some of those atherosclerotic plaques, but actually help improve them. And so the thought is that if you have higher levels of HDL, which you can attain from exercise and the like, that it lowers that burden of atherosclerosis.
And one other thing from, again, musculoskeletal side of things, we're finding that in optimizing patients for total knee and total hip replacements, if you have hyperlipidemia, so your total cholesterol is above 250 or so, you have an increase, it's one of the increased risk factors for infection or peri-operative complications. That, along with poorly controlled diabetes with a hemoglobin A1C over 7, also to a BMI over 40, and being anemic with your hemoglobin under 12. Those are the 4 risk factors. If you have more than 4 of those together, you have about a 50% risk of perioperative complications in regards to total knee replacement and total hips.
Somebody else over here? Yes, you. Where? Oh, okay, I'll get you up top. I'm sorry, but 2 more up top. Hyperthyroidism and sleep.
The slide that mentioned the hypothyroidism was screening out or screening for patients with memory loss and concern for dementia, that you have to rule out some of the medical causes, including hypothyroidism, before giving someone the diagnosis of dementia. I don't know very much about hyperthyroidism and sleep. In that case, yes.
There was somebody up top, I'm sorry. You, right here. The question is to address Mediterranean diet and soy for bone health hormones.
So I don't have really, as far as Mediterranean diet is concerned, again, for us, for bone health, it's just making sure you have an adequate amount of calcium. And again, in many of those cases, you can't get that calcium. You can get the calcium from salmon, for instance, or some of the other things out of it, but I don't have too much to say off of the Mediterranean diet.
Soy becomes a topic that we discuss for hormone therapy and management of kind of menopausal transition symptoms like hot flushes and night sweats. Everything in moderation. There hasn't been really good data that show that the phytoestrogens or kind of the kind of plant-based estrogens have the same impact or actually have the same amount of symptom improvement. So I don't use it as my first line to say, okay, yeah, you should only take soy products because there's other things that come along with it in regards to diet. But that's usually where that comes from, the idea that if you take soy that it'll improve hot flushes, night sweats, and things like that. And I don't think when you study it, anecdotally, sure, it may work well for patients, but when you actually study it, it probably doesn't pan out.
Okay, at this time, we're going to end session 3. Where? Okay, but I'm out of time. Okay, make it quick. You're standing between us and lunch.
Hypo.
Hypothyroidism is more of a problem with the onset of dementia symptoms than hyperthyroidism. But from a primary care perspective, both of them are bad because you can have some psychiatric symptoms from having too much thyroid hormone. Hyperthyroidism does have a psychosis that goes along with it. So from a primary care perspective, as we've talked about before, anything metabolic needs to be under control. So whether you have hyper or hypothyroidism doesn't matter. You need to get whatever it is under control because both of them have ramifications. At this time, I'm going to let Mrs. Dorban describe what we're going to do for lunch. Our session 4 and our final session actually takes place at 1, so we want to get your lunches and get back in here quickly.
All right, thank you, Dr. Huff and Dr. Miller. You were amazing, wonderful. Okay. For lunch, we have boxed lunches, sodas, unfortunately, but lots and lots of water. Okay, let me give you we have 4 choices: ham and cheese, chicken and